The Crying Infant. This video was created to help caregivers and parents understand the crying effects of an infant. Crying is a major concern for parents. It causes feelings of fear for the well-being of their child, stress, and ultimately creates strain on relationships. So what is normal crying? Crying can last up to 5 hours at a time. It may or may not follow a pattern, and it tends to be worse in the evenings. Crying may range from slightly fussy to a strong, vigorous cry. It does last for the first few months of life, and the infant may look pain during the crying session. Always remember that this is considered normal crying. Crying may indicate that the infant is hungry, that they're tired, that they have a dirty diaper, or that they are in pain. Look for a cause for the crying if possible. If a cause for the crying has been identified, try to alleviate the cause if at all possible to help soothe your infant and to decrease the crying. If the infant hasn't eaten recently, try feeding or giving them a pacifier or finger to create a sucking motion to soothe the infant. Try a diaper change. Many infants do not like the feeling of a wet or dirty diaper. Help a crying infant develop trust. Try holding them or rocking them, or small infants may be swaddled tightly to create a sense of comfort. The acronym PURPLE was created to help educate families about their crying infant and the effects of such crying. P represents the fact that infant crying peaks at 2 months of age. It can begin as early as 2 weeks and may last till 3 to 4 months of age. U represents the fact that crying is an unexpected activity and starts and stops at any time. It comes and goes without cause or reason. R represents the fact that infants resist soothing at this time, and the infant may not stop crying regardless of the efforts to soothe them. This P represents the pain-like facial expressions that an infant may give and may not represent their true feelings of pain. The L indicates that crying can be long-lasting, and it can last from minutes to up to 5 hours at a time. E represents evening. Crying is more intense in the late afternoon and evening time. Shaken baby syndrome is real, and it is preventable. So in our frustration from the crying, remember to put your baby down, walk away, take a time out, and ask for help. But always remember, there will be an end to the crying period of your infant. Frustration happens to all parents and caregivers, but we know you love your baby. Ultimately, it is important to remember that it is never okay to hit, throw, or slap your infant, regardless of the frustration or lack thereof reasoning. It is okay to ask for help from friends, family members, or an association. The Crisis Nursery of St. Louis provides care for infants and children across the St. Louis area. Please call if you feel that you are unable to take care of your infant safely. If you have any feelings of harming yourself or your infant, it is a medical emergency. Call 911 now.